It's been a difficult year for many working in the health and human services fields, and for those in need of their care, massive budget reductions have undercut many programs statewide.
The consequences of these cuts remains to be seen in some cases, but for others there was immediate ramifications to deal with. MTN's Augusta McDonald brings us more on how we got here and what's next.
From social work to healthcare to the criminal justice system, the 2017 state budget cuts have slashed services for Montana's vulnerable populations. Heather O'Loughlin directs the Montana Budget and Policy Center, a nonprofit, nonpartisan research group that examines state and federal policies. She says this happened in part because the legislature did not pass measures that could have created revenue for the state.
I think there were a lot of legislators that had a hard line of no revenue measures or no increased taxes. And I think, what we've seen is that has resulted in pretty significant pressure and burden on our most vulnerable populations and the folks that provide services to those families and individuals. And those cuts are going to have a ripple effect throughout communities and long-term implications.
Loughlin says that although these cuts may have balanced the budget now, the state will be paying more in the future as higher levels of care are necessary for these populations. The past year has been a roller coaster for the people whose livelihoods and health care are directly tied to these budget decisions. Now let's walk through a timeline of how these cuts came down. During the 2017 regular legislative session, the Department of Public Health and Human Services took about $29 million in budget cuts. They came from general budget cuts, vacancy savings, and by defunding some Medicaid services. After the session ended, more cuts were triggered in the summer due to a Senate bill that kicked in if state revenue projections came in below what lawmakers expected. Over $17 million were then automatically sliced out of the DPHHS budget. This was from more Medicaid reductions and cuts to targeted case management, as well as unfunded state employee pay raises. The final round of general fund cuts came during the November 2017 special session, where over $49 million were cut from the budget. What made the cuts to the Department of Public Health and Human Services particularly severe was the matching federal dollars that were lost in conjunction with the state dollars when they were cut. For example, during the special session alone, that $49 million state cut resulted in an additional $60 million federal loss. A big part of that is Medicaid reductions. A single state dollar spent on Medicaid services is matched with 1 to 2 federal dollars depending on the program. That loss adds up. Throughout all of the 2017 budget reductions, Montana lost $100 million federal dollars. In total, that's over $200 million in cuts to services funded through the Department of Public Health and Human Services. Director of DPHHS, Sheila Hogan, says the department responded to the cuts by prioritizing 24/7 services in the community and child and family services.
When you exempt the 24/7 people from any reduction in force, because you need people. You need 24/7 people in facilities. We need 24/7 people in the call center for child and family services. We need social workers who can work 24/7. So we've exempted all of those people.
Hogan says the department eliminated close to 400 employees in the operations and administrative offices. These budget losses are now set in stone until the 2019 legislature because lawmakers opted to make the cuts into law during the special session. They didn't have to, and this ended any possibility for the damage to be minimized before the next session.
I think people are hopeful, but when those budget cuts were taken permanently out of the base, it impacts services today, and it's going to impact the work we do in the next session.
In the meantime, service providers and those in need of care are making some tough adjustments. In Missoula, Augusta McDonald, MTN News.
Augusta will continue to look at this complex issue in the weeks ahead.